Good afternoon, everybody. Thank you so much for joining us today. We do have an announcement today, a time-sensitive announcement that we wanted to share with all of you related to a patient that we treated with a suspected blood clotting case following a Johnson & Johnson vaccine. With us today, one thing I do want to make clear, this case has not been yet confirmed by CDC. We await confirmation any day now. But after speaking to the patient and consulting with our leaders here, we wanted to get this information out to the public. So with us today, we have Dr. Yazin Abu Ismail. He's an assistant professor of medicine in the Division of Hematology. He is the physician who treated the patient involved in this case. We have Dr. Richard Orlandi, Associate Chief Medical Officer for Ambulatory Health at U of U Health, and he oversees our vaccine program. We're going to open it up and have Dr. Abu Ismail give you some details about this case. Then we'll open it up to questions. As always, please first put yourself on mute, and then when we open it up for questions, please include your questions in the chat feature. And we do have a Spanish-speaking translator today. Unfortunately, at such short notice, we weren't able to get a physician here, but we do have a Spanish translator available. So with that, I'm going to turn it over to Dr. Abu Ismail.
Hello, good afternoon. I think I should mask off while speaking. Good afternoon. Thank you all for joining us on short notice. And we wanted today to discuss the case of this very rare syndrome known as thrombotic thrombocytopenic syndrome, also known as vaccine-induced thrombotic thrombocytopenia, as coined by the New England Journal of Medicine. Before going into details about the case, I thought it might be helpful to give a little bit of background of this syndrome, which was first described in March by the European medicine agencies following the AstraZeneca vaccine. And this was a very, very rare side effect where it was noted, or it was reported, that there were patients who developed rare blood clots in the cerebral venous sinuses in the brain, in addition to low platelet counts. And at the time, it was felt that this was related to the AstraZeneca vaccine. And shortly afterwards, in April, in the United States, there were 6 cases initially described following the Johnson & Johnson vaccine. And based on the most recent update from the CDC, this count has risen to 17 cases. What we know about these cases is that they were all women, and most of them developed blood clots in the cerebral venous sinuses, although there were other locations of the blood clots, in addition to low platelets, as well as a positive anti-PF4 antibody, which has been a hallmark of this disorder and is thought to be the main cause of uncontrolled platelet activation that leads to thrombosis and low platelets in this disorder. And our patient that we will be discussing today, to the best of my knowledge, is probably the 3rd man in the United States. The very first probable case was actually in the initial safety and efficacy clinical trials that were published in the New England Journal of Medicine. And in the supplementary appendix, the manufacturer did describe a case of a 25-year-old man who developed features of this syndrome. And then about a week or 2 ago, there were reports in the media about a case in the University of California, San Francisco. However, we don't have any further details about that case. And leading on to our case, which happened last week. So I do want to thank the patient for allowing us to discuss certain aspects of the medical history without revealing information that would make him identifiable. And the patient is a gentleman who is less than 50 years old, who received the Johnson & Johnson vaccine earlier last month. And around 10 days after receiving the vaccine, started experiencing symptoms of leg pain that started in his toes and then started progressing to his thighs bilaterally for about a week or so before he eventually presented to the emergency department. He first presented to an ER within the community, and he had normal vital signs over there, and he was first noted to have blood clots in both of his lower extremities, known as deep venous thromboses, that were extensive, in addition to a low platelet count of 74. At the time in the community emergency department, his other testing was normal, and he was started on the blood thinner rivaroxaban, and he was discharged home with close follow-up appointment with his doctor in a couple of days. However, the following day, before the follow-up, the patient started having chest pain, and that led the patient to present to the emergency department at our institution at the University of Utah. And in the ER here, he was noted to have, so a CAT scan was done of his chest, and he was noted to have bilateral pulmonary embolism, which means blood clots in the lungs on both sides. And at that point, he was admitted to the internal medicine department. And I do want to acknowledge the hospitalist attending, Dr. Caitlin Bryant, who was taking care of him and had consulted our team to be involved in the case due to suspicion of a possible relation to the vaccine. At the time of my evaluation of the patient, based on the clinical history, the presence of the blood clots, the low platelets, and the timeline in relation to the vaccine, I immediately suspected that this may be a side effect of the vaccine, as guided by the International Society of Thrombosis on Hemostasis. This would warrant further investigation, and when there is a high clinical suspicion of the disorder, there is testing that is sent, in particular a blood test called an anti-PF4 antibody, and that has been the antibody that has been recognized as a causative factor in this disorder and has been noted to be highly elevated in most of the previously reported cases. And we had also obtained a MRI of the brain to rule out any possibility of blood clots in the brain, because the patient did report some mild symptoms of headaches, and that came back negative. In addition to that, testing for other hypercoagulable conditions was sent out to make sure there isn't any underlying risk factor, and all of that came back negative. He was also tested for COVID, and he was tested negative for COVID. And at that time, based on the constellation of symptoms and his clinical presentation, I had highly suspected that this patient may indeed have VITT, vaccine-induced thrombotic thrombocytopenia, and I had initiated him on treatment per the ISTH guidelines for suspected cases. The treatment for this disorder, as of the most recent guidelines and recommendations, include an infusion of intravenous immunoglobulins, 1 gram per kilogram over 2 days, as well as the steroid prednisone of 1 milligram per kilogram daily, as well as anticoagulation that is a non-heparin anticoagulant. It's also worth noting that the patient was not exposed to heparin at any point recently or during his ER visits, as heparin exposure can cause a similar syndrome to this, and it's important to rule that out as a cause. He was started on the blood thinner argatroban, and in addition to the steroids and the IVIG, and within 48 hours, his platelet counts normalized to 150. Of note, the presenting platelet count was 74, and the cutoff of normal is 150. The patient's normal platelet counts in the past was 177, so we know this is not something he had before. So the platelet count normalized within a couple days, and then on the 4th day of hospitalization, it had continued to go up. His symptoms improved, and essentially the manifestations of this disease had resolved, and he was discharged with close follow-up. He just very recently had a repeat blood count to make sure that his platelets continue to improve, which indeed they do. Currently they are above 200, and he continues to do well and feel well, and I'll be seeing him again in clinic very soon.
Okay, thank you, Dr. Abu Ismail. We do have a question here, and this one will be for you, Dr. Abu Ismail. We have said that the case has not yet been confirmed by the CDC. Can you clarify what has been confirmed and what
Yes.
has not, and talk a little bit about that process for confirmation?
Yes, thank you. That's a great question, actually. So part of the testing for this disease, as I mentioned previously, is the anti-PF4 antibody. So that test did actually result, I should have mentioned that earlier, and it came back as strongly positive at a level of 2.9. Essentially, anything above 1 is positive, anything above 2 is very positive. So the strong positive nature of this antibody is highly consistent with all the previously reported cases in the medical literature, which essentially, at least in my professional opinion, is highly consistent with VITT. A second test called the serotonin release assay, which is also not something that we see with other conditions other than a syndrome similar to this, also came back positive, further corroborating this diagnosis. And so we submitted a vaccine adverse event report immediately, and the report has been acknowledged as received. And just prior to this press conference, I was in an hour-long meeting with the CDC, with a large committee, including hematologists there, discussing the case. The CDC wants to further investigate this. My colleagues, the other hematologists on the call, do agree with the diagnosis. However, there's further investigation that's pending.
Okay, thank you. Dr. Orlandi, are we giving out advice on the J&J vaccine based on this event? Do you have advice that you would give to the general public about J&J and other vaccines?
I think it's important to remember that this is a very rare complication of the Johnson & Johnson vaccine. We're talking about this because it's rare that it's a male in this case, but the Johnson & Johnson vaccine has been given out numerous times, thousands of times in our health system, and literally millions of doses worldwide. And we want to encourage people to balance the risks and benefits of any medical intervention, including vaccination for COVID. We continue to think that the vaccine is generally safe. No intervention is perfectly 100% safe. There are risks in everything that we do. But we will continue to have faith in the Johnson & Johnson vaccine within University of Utah Health because the benefits far outweigh the risks.
Okay, thanks. Thanks, Dr. Orlandi. Dr. Abu Ismail, a question for you. You and I talked briefly before this press event. I think one of the things that you wanted to talk about is while this was potentially an adverse event related to the vaccine, the news here is that now that we've had this pause with the vaccine and we've resumed it again, doctors like yourself have this information now. So it's possible now that when patients present, that we're able to deal with it quickly. So can you talk a little bit about that? And what is your message for patients?
I apologize, Kathy. The sound system cut off, so I missed most of the question.
Oh, sorry about
repeat that, please.
Yeah, I'll repeat that. The question here is, can you talk briefly about while this was potentially an adverse event, the fact that you were able to identify it and treat it very quickly and the patient is doing well. Can you talk a little bit about that as patients are starting to weigh the risks and benefits of this vaccine?
Absolutely. Yeah, that's a great point. I think, there are several things to learn from this case. The first thing is that early recognition is extremely important. And so the first thing, many of my patients will ask is, what kind of symptoms should we look for? So symptoms such as headaches, blurry vision, seizures, leg pain, chest pain, trouble breathing occurring within that time frame should warrant further investigation. And it's usually very simple. Even starting with a simple blood test can help further evaluate this. So that's the first point. Early recognition is important because if this is recognized and treated appropriately, and now we have guidelines on how to treat it, then we believe that this takes care of the disease and should normalize any abnormalities and resolve the condition. The second point is that was previously mentioned, this is a very rare side effect, and so that's why it's important that we display that we're being transparent about these cases that are occurring, so that we make sure that the public continues to trust in the system and the fact that any adverse effects are being communicated transparently. This continues to be a very rare side effect. So, to date, there has been, I believe, more than 8 million doses of J&J vaccine that have been given out, and around 17 cases potentially identified. And so the last thing is that, with the current guidelines, now that we are starting to learn more about this condition with the evolving practice, we are able to take care of this and identify it better, and also understand the variability in how it presents, such as, male and female gender and the location of thrombosis, so that both the patient community as well as the physician community is better able to recognize this rare side effect should it happen.
So
Kathy, if I might add.
Oh, yeah, of course.
Thank you. I think this is a very good example of a healthcare system nationwide and locally working. This is a known complication, a known adverse event that has been well discussed. The patient recognized his symptoms, took all the appropriate precautions to obtain care, was persistent in getting his symptoms addressed, that his condition was recognized because this has been discussed so readily and openly among health professionals. So we are always concerned about an adverse event occurring. But in this case, everything worked as well as it should after that adverse event occurred, and the patient will do well. And I think it shows that the precautions that have been taken with the Johnson & Johnson vaccine seem to be working.
Yeah, I think that's a message here, isn't it? That that's this pause, that we had here for several weeks with the vaccine. This is the outcome, as we now do know more about it and how to identify it and treat it quite quickly. Dr. Abu Ismail, a question for you. Are there any long-term impacts that this patient will experience?
That's a good question. So, in general, with blood clots that may occur in the legs or the lungs, there are certain cases where we would expect long-term effects to happen. I do not think this is one of those cases. So, for example, with deep venous thrombosis of the legs, some patients may experience symptoms of persistent swelling or pain that can last for some time, and then the patient is not experiencing these symptoms. Furthermore, certain cases of blood clots in the lungs, if they were very severe, may have some long-term impacts on the function of the lungs or the heart. And in this case, neither of that has been apparent. So I do not think he's going to have any long-term side effects related to this.
Okay, thank you. And another question for you. While we understand this is rare, should people who receive the J&J vaccine be aware of potential symptoms? So can you review those symptoms again? If people have received the J&J vaccine and they start to experience symptoms, what are those symptoms?
Yes, that's a great question. So, the symptoms, that we encourage people to look out for include any severe persistent headaches or changes in vision or seizures that may be suggestive of a blood clot in the brain, any severe or persistent abdominal pain, as we have seen cases of blood clots that are occurring in the vasculature and the abdomen, any chest pains or trouble breathing, may be indicative of a blood clot occurring in the lungs or a fast heart rate, in addition to leg pain or leg swelling or tenderness to the touch in the lower extremities. All of these symptoms may be suggestive of blood clots. And if the patients experience any of these symptoms, they should contact a healthcare provider immediately. And usually the healthcare provider will start obtaining the initial laboratory workup to evaluate for the possibility of this condition. And that includes beginning with a complete blood count.
Okay, and tell us what you mean by persistent. How long does persistent mean? Is that hours, days, weeks?
Well, it's quite variable from what we know. Usually the pain doesn't really go away unless the condition is treated. So if at any point within the predicted time period, so any time between 4 to 28 days, someone starts experiencing these symptoms, and it comes to a point where it's lasting perhaps hours, and it hasn't gone away, it's important to, at the very least, bring this to the attention of a medical provider who can further evaluate the exact nature of these symptoms to determine whether this is consistent with something that's worrisome or not. Because the presentation, to be frank, is quite variable among cases.
And then once again, what is that window of time that people need to be concerned about from, after they get their vaccine? How many days till you feel like you're past that window?
Yeah, currently the ISTH described that time frame as anywhere between 4 days to, I believe, 3-4 weeks. So that's sort of the time frame currently identified. I believe this is something that may evolve as we learn more about how soon or how late this condition could present.
Okay, thank you. Is this the only case to date in Utah? That might be a better question, I think, to send to the Department of Health. I don't know if either of you are aware.
Yeah, to the best of my knowledge, this may be the first case in Utah. It's certainly the case at our hospital here. And I do work closely with the ARUP laboratory, and they have reviewed 3 similar cases. But from what I've been made aware of is that the only case that has happened within our state is this one. But that may be inaccurate.
Okay, so Roger, I think it will probably be best to follow up with the Department of Health on that, just since we don't know for sure. And then, is it a total of 17 confirmed or suspected cases nationally that we're hearing about?
Based on the CDC report that was published on April 30th, my understanding is that this is 17 confirmed cases. 12 of those were published in the medical literature, so these are the ones where we have exact details about the presentation, and the others were reported through the VERSE system to the CDC. Okay.
Dr. Orlandi, a question for you. We are continuing with administering the J&J vaccine here at U of U Health, correct? And can you expand on that a little bit?
We are continuing to administer the Johnson & Johnson vaccine at U of U Health, as well as the Pfizer vaccine. We are encouraging patients who might be at risk for this thrombosis syndrome to consult with their medical provider to decide which vaccine is for them. And we are advising patients of this risk prior to scheduling for the Johnson & Johnson vaccine so that they can make an informed decision. This is an extremely rare event, but nonetheless, we are advising patients so they can make the best decision in concert with their healthcare provider.
And then, Dr. Orlandi, do you want to provide a little bit of context about the risk of this versus the risk of becoming ill from COVID?
Yes, the risk of this complication is extraordinarily rare. And as we've said, 1 or 2 out of a million. And the risk of contracting COVID without vaccination, of becoming ill, of becoming hospitalized, or even the risk of death from COVID is much higher. So it is a balance that each of us will need to factor in for himself or herself. We at University of Utah Health strongly encourage and continue to strongly encourage our patients and our entire community to be vaccinated. We take all of these risks very seriously, and in balancing them, we strongly advise that patients and our community be vaccinated.
Unmute myself there, thanks. A couple other questions coming in. Dr. Abu Ismail, what puts someone at risk for VITT? Is it VIIT or VITT?
VITT, vaccine-induced thrombotic thrombocytopenia.
Okay, what puts people at risk?
That's actually a great question. So to date, because of the very small number of patients who have been affected by this, we have not sort of identified any specific risk factors that can say, hey, you're more likely to get this than the others. We do know that there is a female predominance. So for example, in the United Kingdom, the VITT cases related to the AstraZeneca vaccine, there's been about 200 cases described with a predominance in women, about 60%. And it seems to be occurring in patients within the 20 to 50 years old time frame, or age range rather. In America, with the Johnson & Johnson, we know that the first 15 cases were all women, and we're coming to learn more about cases happening in men. I would imagine that the demographics would probably be similar. But so far, that's as much as we know about who seems to likely more affected. However, because these numbers are so small, it is difficult to jump to conclusions on who is at a greater risk of this syndrome. And that's why I believe, when the CDC and FDA issued the warning, they didn't specify a certain demographic.
But there is, as I understand it, the recommendation for women under the age of 50 to maybe have a discussion with their physician. Is that correct? Do one of you want to comment on that?
Yeah, that is correct. And, of course, any patients with history of blood clots should consider this as a possible risk factor, although we do know that the patients who've had this syndrome did not really have any prior medical conditions putting them at risk of blood clots. And that's likely because the mechanism through which the blood clots happen is very different than the usual traditional blood clots. But it's something to bring up to the attention to the medical provider.
Okay, and Dr. Orlandi, are we having those conversations with women who are getting the J&J vaccine if they're under 50?
We are. We're advising all patients, as with the CDC and the FDA guidance, all female patients under the age of 50 who are electing to have the Johnson & Johnson vaccine. We're having that conversation with them ahead of time so that they are fully made aware of their risks. We continue to administer the Johnson & Johnson vaccine. We continue to have faith in it. We also continue to administer the Pfizer vaccine. For some patients, it will work better to have one shot and be done. For others, it will be better to have the two-shot Pfizer regimen. And each patient needs to be having that conversation with their healthcare provider so they can make the best decision together for that patient.
And here's a question. Of the 17 confirmed cases, is this the only male that has presented complications? I believe you said this was the third?
So the other two cases are not entirely vetted. So the ones that have been published by the CDC are all women. However, the other two men, the first one was described in the J&J safety and efficacy trials. That patient was not labeled as he had all the presenting features. He had a blood clot in the brain and hemorrhage and low platelets and a positive PF4. And then the second case, we don't really have any information about. All we know is what was reported in the media by the University of California about a week or two ago.
Okay. And do we know why vaccines are causing this syndrome? Or do other vaccines cause blood clots? Do you want to take that one, Dr. Orlandi or Dr. Yazin?
I can comment a little bit about this. So that's a great question. What we have seen, so the J&J and the AstraZeneca vaccine share a similar mechanism. They are both adenoviral vector vaccines, meaning they use a viral vector made of the adenovirus. Now, this is not the same type of vector that is used for the other traditionally used vaccines, such as flu vaccine and measles and rubella and so forth. So it's sort of unique to COVID and a few other less commonly used vaccines. As to the mechanism remains unclear as how to this occurs. Well, we know that there is some sort of pathologic antibody that is being produced by the body in response to the vaccine that leads to this syndrome.
Okay, and I think you basically answered this, but why this vaccine versus Pfizer and Moderna?
Yeah, so the mechanisms of the Pfizer and Moderna vaccine are quite different from the Johnson & Johnson AstraZeneca vaccine. So the Pfizer and the Moderna use a mRNA technology, while the J&J and AstraZeneca use the adenoviral vector. And so far, what we're seeing is that this is only occurring with the adenoviral vector vaccines. And what I'm referring to here is the specific syndrome of vaccine-induced thrombotic thrombocytopenia, not blood clots in general.
Okay. And then I think we should clarify too, there are other risk factors for getting blood clots to compare. For example, birth control pills, pregnancy, things like that. Can you talk a little bit about that to kind of help people keep things in context?
Yeah, for sure. So there are many risk factors that we know of that can cause blood clots in the general population. You mentioned pregnancy and birth control pills and other comorbid conditions, high blood pressure, diabetes, obesity, or blood clots, or a history of blood clots. However, it doesn't seem that these risk factors are necessarily correlating with the incidence of VITT, which from a scientific sense, could make sense because our understanding of this syndrome is that it's not necessarily related to underlying risk factors. Most of these patients seem to be young and healthy, but it's the antibody that's being formed by the body as a result of this condition, what's causing this syndrome. And again, this is super rare. We don't fully understand why it's happening, and there's a lot of evolving science in the medical literature about this.
Okay. And I want to remind everybody, we do have a member of our interpreter services team here today. So if we can answer some questions in Spanish, we're happy to do that. Any other questions from media today? Dr. Orlandi and Dr. Abu Ismail, do you have any final thoughts that you'd like to share?
I'll just add, we certainly understand that patients can be somewhat reluctant to be vaccinated, and that this may increase that to some degree for some patients. We understand that, and at the same time, it's very important that we keep all of this in context. As we discussed, there are many interventions, whether it be birth control pills or other things, that have a much higher risk of forming blood clots. We have a much higher risk in our daily activities of significant injury, and that this is exquisitely rare. In all of the different things that we do, we have to balance risks and benefits. In this case, of this gentleman, and in all cases with our patients, we want the very, very best for them. And in weighing the risks and benefits with COVID, as opposed to COVID vaccinations, we strongly encourage all of our patients and all of our community to become vaccinated, because the risks of the vaccination are much less than the risks.
Dr. Abu Ismail, any final thoughts?
Yeah, certainly. I mean, I agree fully with that. It's important to realize that this is an extremely rare side effect, and that every time such a side effect is occurring, it's being very transparently communicated so that we learn more about it and that we recognize it sooner, allowing us to treat it effectively, as was the case with this patient. And at the end of the day, it's important to realize that there's a lot of benefit to gain from the vaccine in battling this pandemic.
Okay, let's see. I'm getting a question here about, is there a risk of getting a clot from COVID? Can COVID cause this?
Yes, thank you for asking that. So that is a great question, and the answer is yes. There is. It has been demonstrated that COVID does increase the risk of blood clots, and this has been estimated to be anywhere between a 10 to 30% risk, which is very high, particularly in those who are severely ill with COVID. Now, the mechanism is sort of different than what we're talking about, and the overall syndrome is not the same thing, in terms of the occurrence of low platelets and the presence of that antibody. But yes, COVID can cause life-threatening blood clots.
Okay. I'm going to ask you two gentlemen to stay. I want to be clear that our two medical experts here today do not speak Spanish. We do have a Spanish translator on, so I know we have a couple questions that I think we're going to turn to you, Jafet. We have a couple reporters who are going to ask you some questions, and then please feel free to also ask our other experts, but again, they don't speak Spanish. So let's open it up for Spanish language here. If anyone else has questions, please feel free to follow up with myself, Kylene, or Sue on our team. We'll make sure we get answers for you. And we've recorded this. If you need a recording, let us know. And I think we're going to turn it over to Spanish here. Thanks, everybody. Francisco, did you have some? Okay, Jafet, the question is in the chat if you're looking at the chat.
Question, or can someone repeat the question?
It's in Spanish, so I think Javette will say it for you.
Yeah, Jafet, can you say the question first in English?
I was muted.
Yeah, say the question first in English and then answer it in Spanish. And then
Okay.
if Francisco also wants it answered in English, we can do that as well.
Hello, doctors. Would one of you know or be able to tell, explain what you have seen in Spanish? Just a brief summary. He's saying.
Do you want to answer that, and then he can translate it?
Yeah, just to clarify, like a brief summary of the case or the
¿Un
syndrome.
resumen del caso o del síndrome? About the case.
About the case. So yeah, in a brief summary, this was a gentleman who is less than 50 years old, who is healthy, exercises regularly, doesn't have any comorbid conditions, or does not smoke. And
sorry, would you want me to just translate orally or just type it for him?
I think let's let the doctor answer the question, and then you can translate. Let's do it that way.
Okay, sounds good.
Okay, so Dr. Abu Ismail, go ahead.
yeah, so he received the J&J vaccine, and around 10 days later started developing lower extremity pain in his legs, starting in the toes, going to the thighs. He was initially seen in a community ER and noted to have blood clots in his legs and low platelets. He was at the time discharged on a blood thinner. However, this next day he started having chest pain and presented to the University of Utah emergency room, where he was found to have blood clots in his lungs as well, in addition to the low platelets. And he was admitted to internal medicine, and my team was consulted, and at that time I had made a presumptive diagnosis of VITT and started him on immediate treatment for the syndrome until the confirmatory testing had resulted about a day or two later, consistent with the diagnosis. Afterwards, he had continued to improve. His platelets returned back to normal, and his symptoms have resolved, and we're closely monitoring him, but he's doing great.
Entonces, vieron a este paciente fue, presentó entonces dolores en las extremidades y fue a una clínica de la comunidad para que lo vieran de urgencia. Entonces, luego le dieron medicamento para anticoagulación y luego se fue a su casa, regresó aquí a nuestro centro University of Utah, aquí, y es donde lo diagnosticaron con lo que el doctor, con el acrónimo VITT. Entonces, le dieron, también le revisaron las plaquetas, estuvieron bajas, entonces le dieron medicamento, le administraron medicamento y dentro de uno o dos días empezó a ver mejoría.
Okay, Kimball, do you want to, I'm not sure how you want to handle that.
Sure. I'll just ask my question to the doctors directly, and then if we could have the translator take over after that, I think maybe that would be easiest.
Perfect.
Okay. So I was just wondering if you guys could explain one more time a little bit about, so, you know, we know that this case is here in Utah, could be the first or among the first here. Does that cause you as medical professionals to reevaluate at all the use of the Johnson & Johnson vaccine?
I can take that. Okay. Thank you for your question. In our vaccination program, as in anything we do, we are monitoring the risks and weighing those against the benefits of any of our interventions. As we look at the risks of the vaccine, particularly the Johnson & Johnson vaccine causing blood clots, we understand that this risk is very, very rare, 1 or 2 in a million. And when we look at the risk of having COVID, the risk of being sick, of being in the hospital, of dying, of giving it to somebody else in our community, in our family, and as we weigh those risks and what we can do to diminish those risks, we feel that to do is to be vaccinated against COVID-19. We will, at University of Utah Health, we will continue to use the Johnson & Johnson vaccine. For many patients, this is the best solution because it requires two. For various reasons, this will be the best solution for many patients, and we will continue to offer it, and we will continue to inform patients of this risk of blood clotting, this very rare risk.
Jafet, you're on mute, sorry.
La pregunta es que explique si aquí en este caso en el estado de Utah entonces va a ayudar a reevaluar si van a usar la vacuna de Johnson & Johnson. Y luego dice, como vemos entonces el riesgo es raro, es muy mínimo, entonces por lo cual entonces pensamos que el riesgo es mínimo y entonces queremos todavía seguir entonces usando la vacuna de Johnson & Johnson porque pensamos que para unos pacientes que solamente requieren una vacuna entonces es más convenible.
Okay, thank you. And Jafet, can you take a look in the chat? Francisco has another question.
I can unmute myself.
Okay, yeah, there you go.
Okay, I'm gonna ask just, I know you already, doctors, I know you already spoke about this, but just for translation purposes, how can you, what can we tell our audiences, you know, in the media to not be scared? You know, it's something that people in our community are facing. Some of them don't want to be vaccinated, and hearing this type of news obviously brings some fear in some of our audience. And what would be your message for them? Thank you.
Thank you for your question. We're happy to repeat it repeat the questions or repeat answers as often as we need to make sure that all of our community understands. We understand that this is scary for patients. COVID is scary, and all of the information that is true is scary, and sometimes we have information that's not true that is scary. Medical professionals, we want what is best for our patients and what is best for our community. And as doctors and scientists, we're looking at all of the information to try to balance what's best. And that's why we encourage our patients to speak with their healthcare providers to get the best possible information for them. We understand that when we hear about something like this, it can increase that anxiety and that fear. We have to realize that everything we do in life has risks, and we don't always think about those risks as we travel down the freeway, as we take other medications, as we do 100 other activities in life that we do every day. Each of those has risks, and we have to understand that this is just one of those risks. It's very, very rare. And the risk of getting COVID, if you're not vaccinated, and of having a complication from COVID or becoming very ill is much higher. And so while we wish we didn't have to balance those risks, we do. And we do encourage our patients and our community, the people that we care for, to become vaccinated to reduce the risks associated with the pandemic.
Gracias por la pregunta. Entonces entendemos que hay miedo, ¿verdad? Pero así como profesionales queremos entonces que sepan que nos preocupamos de la comunidad y queremos proveer entonces esta información a nuestra comunidad para que entiendan los riesgos. Y es semejante así como, por ejemplo, el riesgo que uno toma manejando en la autopista, ¿verdad? Hay ciertos riesgos, pero realmente pueden ser mínimos. Nosotros pensamos que realmente hay más riesgo en contraer, por ejemplo, lo que sería el COVID y los síntomas que podría tener y el impacto.
Okay, do we have any other questions for Jafet or our physicians before we close out? All right, I think that's it. Thank you. Thank you everyone for joining us today. And again, if you have any other questions, please feel free to follow up with anyone on the media relations team. We'll make sure we get answers for you. Thanks, everyone.